Hi everyone, so for this week I'm going to be presenting an annual well woman exam I did on a patient at my clinical site. So I'll just get started. So this patient, MH, is a 60-year-old female, and she presented to my clinical site yesterday for a well woman exam. It had been over 5 years since she had seen her PCP, so she was considered a new patient to the nurse practitioner I work with. So the reason for her visit is her annual well woman exam. She did not have any active complaints at this time. She is a, like I said, 60-year-old patient with a history of multiple myeloma. She's had a bone marrow transplant and chemotherapy. She's now in remission and presents for her annual comprehensive wellness exam. Like I said, she hasn't been seen in over 5 years, as she was seeing oncology frequently, and she was also enrolled in a clinical trial for multiple myeloma. So she was doing frequent visits between oncology and getting care within the clinical trial, so she didn't see it necessary to come in to see her PCP. So that's why it had been so long since she had been seen. Her last pap smear was August of 2011, and her last mammogram was July of 2015. She did have a total hysterectomy in 2011 due to a large fibroid and cancer history, the multiple myeloma. So in my clinical site, part of the HPI and opening part of the visit is to always ask when their last pap and mammogram was. That's kind of how my preceptor does her visits, and I found it to be beneficial to address that right away. So we always address that right away with our well woman visits. So right away we know that this patient is not going to need a pap smear today, as she is status post a total hysterectomy. According to guidelines, after a total hysterectomy, there's no longer a need for age-related screening. And if she did have a history, though, of CIN, you would do vaginal cytology, but she has a history of multiple myeloma, so there's no need to do that. As I said, there's no active concerns for this patient. Her current medications are albuterol, inhaler, 2 puffs every 6 hours as needed for wheezing, which she has not used. Premarin, 1 tablet by mouth daily. Synthroid, she takes 25 micrograms daily. Lisinopril, 10 milligrams daily. She does not have any allergies. Okay, and then social history and health maintenance history, health habits history include no smoking. She does have alcohol occasionally on the weekends, 1 or 2 glasses of wine. She does not use any drugs. She has 1 cup of coffee per day. She does exercise daily. She likes to use a treadmill. She goes hiking. She does bar classes. Her diet is adequate in calcium and fiber. She does not do self-breast examinations at home. She is safe at home. She wears a seatbelt daily, and she does wear sunscreen and have routine dermatology checks. Her family history includes coronary artery disease in her father and breast cancer for her mother. She lives in Wellesley with her family. She works as a pastry chef and also is a chocolatier on the side, a hobby for her, which I found very interesting. Review of symptoms. In general, she is a well-appearing Caucasian woman in no apparent distress, appropriate affect and behavior. No fevers, chills, sudden weight changes. Her skin did not, I'm sorry, let me go back. Review of symptoms. I started on the physical exam. Review of symptoms. So general, she denies any fevers, chills, malaise, or sudden changes in weight. No new moles, growths, or slow healing wounds on her skin. For head, eyes, ears, nose, and throat, she denies headaches, no changes in her vision. She does get her eyes regularly checked and regular dental checks. No changes in her hearing and no difficulty swallowing. For breasts, she denies any nipple discharge, or new lumps. Cardiovascular, she denies chest pain, she denies palpitations, and she denies swelling in her ankles. Respiratory, she denies shortness of breath, she denies dyspnea, she denies wheezing, and she denies cough. GI, she does not have any nausea, she does not have any vomiting, she denies diarrhea, she denies constipation, no bloating. She does use stool softeners daily. No urinary incontinence, no dysuria, and she denies hematuria. And GYN, she is status post a total hysterectomy in 2011, and she is sexually active. Mental status, musculoskeletal, no changes in her strength, no back or neck pain, no lower back pain, no myalgias. Neurology, no changes in sensation or muscle coordination, no tremors, and no changes in gait or her balance. So now we'll move on to the physical exam. Her vital signs were as follows. Blood pressure is 128/78, pulse 84. She weighs 128 pounds. BMI is 22.8. Physical exam. Her skin upon exam had no worrisome lesions or concerning nevi. Head, eyes, ears, nose, and throat. Her pupils were equal, round, reactive to light and accommodation. Extra ocular muscles were intact, no nystagmus. Fundus exam was benign. Lenses are clear. Vasculature normal. Discs are sharp. And her ears, tympanic membranes, landmarks were normal and clear. No cerumen in the external ear canal. And then her posterior oropharynx was benign, no lesions or no lesions present. Her neck, no lymphadenopathy, no cervical, supraclavicular, axillary, or inguinal adenopathy. Her thyroid was palpated, and no mass. Respiratory, her respirations were full and unlabored. Lung sounds were clear throughout without adventitious sounds. Her breast exam revealed dense, symmetric in contour tissue. Areola edges are intact without dimpling or puckering. No nipple discharge, and breast tissue was out suspicious masses. Cardiovascular, normal S1 and S2 sounds. Rate and rhythm was normal. No extra heart sounds. No murmurs or extra heart sounds. Abdomen was soft, non-distended. Positive bowel sounds in all four quadrants. No tenderness, no guarding, no masses, and no hepatosplenomegaly. Her extremities were without edema. Positive pulses, symmetric. And her neuro exam had intact cranial nerves to sensory stimulation and in motor response. Her deep tendon reflexes were 2+ and equal. Planters were downgoing. Her strength was 5 out of 5. She did have a balanced and coordinated gait. So assessment and plan for this patient going forward. She is a generally healthy 60-year-old woman with the following addressed today. We did address some healthcare maintenance topics for her just because it had been 5 years since she had been into the office. She did not have any active complaints, but she is no longer in the clinical trial for multiple myeloma. So we did order a thyroid panel, a lipid panel, a basic metabolic panel, an A1C, and then also a pneumococcal vaccine. She is due for that, a Tdap as well, and then also a mammogram because it had been, she is due for her mammogram. Her last mammogram was 2015. As I said before, we will not be doing a cervical cancer screening on this patient due to guidelines after a total hysterectomy. Follow-up is routine, next year, annual. Differential diagnoses for this patient. were to follow up as needed. No differential diagnoses were actually discussed between me and my preceptor, as she was healthy, presenting without any problems, just presenting for reestablishment of care. And that's my patient. Thanks, guys.